Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True Show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for True show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to welcome you back. Tonight we have a very special show because I don't know anybody who doesn't complain about stress. It seems like with all the innovations and advances we've had technologically, but boy, can we sure use something for stress, for relaxation, being healthier, being well, sleeping well, a myriad of different symptoms and consequences of this modern life that we lead. And so it's our pleasure tonight to introduce you to a very special doctor, Dr. Emil Tocci, who's director of the Family Chiropractic and Holistic Lifestyle Center of New York. And engineer, if you can put his pictures up on the screen, there you go. There's that handsome guy, Dr. Tocci. And he's a holistic wellness doctor and certified clinical nutritionist who has treated patients in the metropolitan New York area for over 16 years. The doctor is also a functional medicine expert and certified sports practitioner with extensive knowledge and research in anatomy, physiology, neuroscience, and clinical nutrition. Since 2001, Dr. Tocci has been a featured speaker at the New York City Department of Health, at Verizon, at Holy Trinity Lutheran Church, Oceanside Adult Education Center, the New York Sports Clubs, Molloy College, the Realm of Agape Christian Church, the Oceanside Chamber of Commerce, the Town of Rockville Center, the Calvary Protestant Church, Island Park Fire Department, Advanced Learning Daycare Center, and many, many others. There you see him on the screen. And engineer, if you can, let's bring him up live on the screen with us and bid a warm welcome to Dr. Emil Tocci. Welcome to our show, Doctor.
Oh, thanks a lot, Doc. I appreciate it. Some of those pictures have a lot more hair than I currently do, but hey, I'll take it. No, thanks so much for having me. I really appreciate the opportunity to come and share some information with you. Thank you.
Well, it's our pleasure, and your topic, is so important. As you know, I'm also a doctor and surgeon, and I don't know too many of my patients from the metro New York area who don't feel stressed, sometimes out of sorts, get angry or apathetic, depressed. So your topic is right on the money, and actually I want to get right to it because I know there's so much we have to cover. But first, I was very curious because you're a healer, you're a helper. How did you come about on this career as a chiropractic doctor?
Yeah, that's a great question. I was senior in undergrad, so I went to college upstate New York in Cortland, and I was working out with some friends and actually hurt my back. And later that day, I just couldn't get a comfortable position. I slept on the floor on my stomach. I got up the next day and I could not get off the floor. So I reached over, I grabbed my portable phone. This was in the 90s that I'm a cell phone. Back then, I didn't have one. So I called my mother, who was in Allen Park, where I grew up over here in Nassau County. And she was 5 hours away. So I was telling her, listen, I can't get off the floor. None of my friends are home. I'm in my house off campus. So she told me, she's like, well, I guess you got to go to the hospital. So my friends came home. Two of them tried to get me off the floor. It was excruciating. We actually had to call the ambulance. 2 EMTs came to my house. They actually, firemen carried me down the steps, put me on a stretcher, and took me to the hospital. I got rolled into the hospital, and I was really nervous. I couldn't move. I'm 21 years old. I'm supposed to be at my peak health, and I'm supposed to be invincible. And I was at the lowest point in my life with my health. The doctor, really nice guy, comes over to me, and I want to explain to him what happened. And he said, listen, hold on a second. He lifts up my shirt. He says, look, you got a muscle pull. We're going to inject you with some medication. And at the time, it seemed like the best idea. So the nurse came over with a needle like this big, and they gave me a local. It wasn't an epidural. There was no x-rays, no testing or anything like that. They just gave me the epidural. I mean, the local injection. And you know what? It kicked in. It actually helped. I was able to actually get up. And I was like, wow, this is great. I asked him if I should do anything on my own. He said, yeah, go get a heating pad. Well, I go buy this dry heating pad, and I laid on it that night. I got up the next day, and I was a disaster. So my friends had to help me carry my books to school for like 2 more weeks after that. But, when you're 21, you tend to bounce back a lot quicker. But during that time, I never forget, I went out to breakfast one weekend to a diner and ran into a friend of mine. We were both biology majors and chemistry minors. We used to study all the time. He's a little older than me. He had graduated, and he was back up visiting. And he was telling me that after he did undergrad, he did his 4 years. And now he was doing 4 more years. He was studying to become a holistic doctor, a chiropractor. And he started to tell me about it. And I started to tell him what happened to me. And he started to ask me some questions. He said, well, what they say is causing the problem. And I said, well, he said it's a muscle pull. He said, well, listen, it's not that simple. You have the bones are stacked up on top of each other. You have the discs. You have the spinal cord. There's a lot of structures in there. He said, what did the testing show? And I said, well, they didn't really do any testing. I mean, in the emergency room, they're just making sure that, you're stable and you're not going to die. And they didn't really do any testing. And he asked me this question. He said, if you don't find out what's causing it and correct it the right way, what do you think is going to happen in the future? And that made a lot of sense to me. I actually graduated that spring. I got home. I actually called him up, and he was in Connecticut in school. And I started talking to him, and he invited me to come visit him in Connecticut at his school. And I went to visit him, and I actually went through the classes with him, and I loved it so much, I actually applied to the school. And I needed to take another class in between, so I took the year off in between, but that's how I actually got into it. When I got to school, though, I got evaluated, and my spine was a mess. I played a lot of sports growing up, and I started to get taken care of in school. I started a care plan for myself, and what I started to notice for myself was that it helped with my pain, my posture, my range of motion. But as time went on, I was able to sleep better. My digestive system was working better. My immune system was working better. I'd come back home to New York, to Long Island, to visit my friends. We're in our early 20s. And a lot of my friends were taking some over-the-counter medications for like allergies and sinuses and sleep issues. And I wasn't taking any of that. And I've been under weekly care myself for, since about 1997. So exactly what I explain to my patients and how I educate my patients, I actually live it myself. And a lot of my friends who don't live around me, a lot of them right now are on medications for high blood pressure and anxiety and thyroid and cholesterol, and they take a lot of that stuff. And I really feel like this was a blessing. It got me on a different path, and I've been on that path ever since. So, yeah, that's how I got into it.
Well,
yeah.
You know what? That's so fantastic. Not that you went through that, but that you have that background, because you really have empathy for the patient. You realize, I know when I go through things, because I hurt my shoulder about 1.5 years ago, and I realized a lot, and sometimes you have to go through it to understand. So you're the perfect guy to do what you're doing. And so I wanted to get right to the next question that I had for you, because everything makes total sense what you're saying. So, people always talking about stress, I've got stress, or what do I do about it? But let's go a step
Yeah.
at a time here. So what are the three main types of stress that exist?
So, and that's a great point. So the three main types, and I always tell people, look, if you're dealing with a health challenge, there are two main reasons with one main cause. So if someone is taking notes, you want to write this down. It's a toxicity. Either you're taking something in that's toxic and or a deficiency. You're deficient in something that your body needs to be healthy, caused by stress. And there are three main types, and there's actually a fourth type, which most people don't really talk about yet. But the three main types are physical, chemical, and emotional. Physical stress, chemical stress, and emotional stress. Those are the three main types of stress.
Interesting. And so then explain that. What is this fourth type that you alluded to, but you didn't really say anything about? What's the fourth one?
It's EMF, electromagnetic frequency, actually affecting us, and it definitely affects our health. That's the fourth type of stress. It's EMF, electromagnetic frequencies. Yeah.
Interesting. So, and you kind of cut out a little bit there for a moment with the internet. So the fourth type with the electromagnetic frequencies, those are what you're talking about then would be what? Cell phones, microwaves. Give some examples.
Cell phone towers. Basically, even like your electric box at your electric that comes into your house. Some people take it as far as like Wi-Fi in their house and stuff like that. Don't sleep with your cell phone next to you if it's not on airplane mode. Don't put your cell phone in your front pocket right there because it can affect your heart and stuff like that. So, yeah.
Very, 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 very interesting. So now, in terms of these, all four of them, because I know the viewers are probably as interested as I am. So give us an example or examples of each one of these types so that we can actually have an idea of what we should control in our lives. Go ahead, start. You said one was chemical, right? So let's start with that one, chemical.
Sure. So, what we usually do is say, look, there's a lot of chemicals in the environment. And one chemical I like to make people aware of is glyphosate. They spray it on all the food. And basically, if you're not eating organic, then you're definitely going to be affected by that. So we're always encouraging people to try to eat organic whenever possible. And, a lot of people say, listen, it's expensive to eat organic. And I get it, So one company that we use is actually called Misfit Markets, where they actually send produce that maybe isn't shaped perfect to put on the shelf. So there are ways to, find produce that's organic at less of a price, or you can go to local farms, but, try to eat as clean as possible because glyphosate is definitely one of the chemicals that affects us. There's definitely heavy metals that can affect us also. So Doc, I know you're a dentist, and I'm sure you've seen like the smoking tooth video. As people get older, their teeth start to grind. So like my mercury was really high. I had the Huggins protocol and got the mercury taken out of my mouth, for example, but I had high arsenic, which that can be in water and rice. So we're up against a lot in the environment. One thing really quick, so I do want to answer this, is I just want to back it up really quick for a second, because here's the thing. If you can understand that physiologically, the same stress response that we're under now when we're under stress is physiologically the same stress response that we were under when we were running from tigers. Physiologically, the same things happen inside of us when we're under stress. So if you can look at a few of those things and just be aware of them, you can see why we are sick and why we actually break down. So would it be okay if I touched on that really quick?
No, absolutely. Go ahead.
So if you would imagine like a tiger was to walk into the room right now, because a lot of people will say, well, I'm sick because of my genetics. And we always say to people, listen, the two main studies when it comes to genes, the China study showed 5% genetics. MacArthur Foundation showed 25%. So if you go on the high end and say, listen, it's 25% genetics, it's 75% potential. We want to maximize our genetic potential. And the new science is epigenetics, which means above the gene, meaning that genes are either turned on and expressed or they're not based on your lifestyle. So our genes, even if we look at the last 100 years, we haven't morphed into some different species. So our genes have been like this. Chronic illness has skyrocketed, and they're trying to tell you it's your genes. And what we're trying to say is, no, listen, it's lifestyle, and epigenetics is the new science. So if you look at what happens during the stress response, and you can just understand a few of these things, you can really see why we break down and get sick. So If a tiger was to walk into the room, your eyes would open up wide. You'd be looking for escape routes. It wouldn't be a good time to like sit down and concentrate and memorize a laundry list. Feelings of stress and anxiety and worry would increase, and your stress hormones would increase. So cortisol would increase, and cortisol, which is a major stress hormone, actually blocks dopamine, which is a focus hormone, and it blocks serotonin, which is our happy hormone. 95% of serotonin is made in your gut. Now, so it's really important to have a healthy gut, and we can touch on this if we get time, but we can talk about leaky gut and how that's a causal factor to systemic inflammation, because another thing is that if your stress hormones stay high, chronic increased cortisol leads to systemic inflammation. So we know inflammation is a causal factor for disease, but during this stress response, this fight or flight, this sympathetic stress response, your heartbeat increases and your stroke volume increases, and most of the blood in your body, and so your blood pressure goes up also, most of the blood in your body goes from your core right here, where all digestion and absorption and assimilation happens, and most of the blood goes into your extremities, into your muscles, into your arms and legs. So you could either run, it's flight, or stay and fight, okay? This is preparing you for this, and this saves your life in the short run, but if you stay stuck in this, it's not good. Another thing that happens is insulin becomes resistant during the stress response. And if insulin's resistant, insulin's one of the master hormones in our body, but insulin, obviously, it runs a lot of reactions in the body. It's one of the master hormones, but if it stays resistant for a long time, it's another factor that increases systemic inflammation. But when insulin stays resistant, it increases your blood sugar. And when sugar stays in your blood, it increases the viscosity of the blood, the thickness. It makes it thick like molasses. And it's harder to pump through the blood vessels. Another thing that happens is that the sugar scrapes the inside of the blood vessels, the intima. On the inside of the blood vessels, it's like sandpaper. And it breaks it down, and it creates an inflammatory response where sticky factors and clotting factors and sugar can actually adhere to that area. And it creates a situation and a condition known as atherosclerosis, hardening of the arteries. Atherosclerosis is the number one causal factor for stroke and cardiovascular disease. Another thing that happens, just I want to touch on three more things. One is that our cell-to-cell immune system gets shut down during the stress response. Why? Because a white blood cell is not going to save you from a tiger, so this is very intelligent. And another thing that happens is LDL increases and HDL decreases. Now, a lot of times when I tell people that, I'll ask them, I'll say, hey, what's LDL known as? Oh, it's the bad cholesterol. And one of the major principles that we educate our patients about is the fact that your body doesn't make mistakes. This intelligence in your body doesn't make mistakes. So there's something called universal intelligence. There is something organizing everything in the universe. Now, what's going on out here cannot be explained by math, physics, and chemistry alone. So it's a fact. Now, a lot of people call that God. It's not about religion. You can call it whatever you want, but there's something organizing everything in the universe. And then inside of each and every one of us is a piece of that intelligence. We call it an innate intelligence. So if someone's sitting there and they ate something earlier, like you're not saying, okay, spit out that enzyme, digest that food. Like there are things happening inside of you that you're not consciously controlling. So that intelligence basically flows from your brain down through your spinal cord, out your nerves to every cell, tissue, and organ in your body. So your brain's working as a generator and a computer, okay? And we can come back to that. But another thing that happens during the stress response is that sex hormone binding globulin gets shut down. Why? Because if you're running from a tiger, you're not thinking about reproduction. So really quick, I want to go into your question about, the three types of stress and how to counterbalance them. But I always step back for a second. I ask people, I say, listen, if this is what happens physiologically today when we're under stress, which we're going to talk about, if you stay stuck in this, what does that do to your health? Well, how are we looking for cardiovascular disease, cancer, which we know is an immune system issue? How are we looking for feelings of stress and anxiety and anxiousness? We know mental health is one of the top leading causes of permanent disability. How are we looking for fertility issues? You just look, it sets up a nightmare. Over 50% of people have a hard time getting pregnant. And I'll explain to people that, listen, even if they do use some medical procedure and they use the medical system, like IVF, for example, and maybe they get pregnant, that's amazing. God bless, that's amazing. But during that pregnancy, is that considered high risk or low risk? That's higher risk. So that means more testing, more visits to the doctor, more, hey, we think we might see something, we're not really sure, come back in a couple of weeks. So mom's under stress, even when, she's pregnant, which affects baby in utero, and that creates a situation known as uterine torsion, where the uterus can literally turn like this, and baby stays like this, going, I'm not going down there. I'm going to stay breech. I'm not going head down. That's too tight down there. So we can go on and on about like the cascade of events that happens to set people up. Because if you're sitting here right now and you're dealing with a health challenge, I'm trying to bring people back to the fact that most of our problems started a long time ago. But if you can understand the stress response to just a few of these parameters, you can see why we break down and get sick. So, going to the question which you're asking, which is great, like what are the types of stress? And then, which are the most common in each category and how can we counterbalance that? I think it's a really relevant conversation because we need some, steps and strategies that we can take to counterbalance this.
Absolutely.
That makes sense.
You know what? That's a fantastic explanation. Makes a lot of sense. And I know a lot of the viewers probably already saying, wow, I can already modify that already just by what I'm putting myself under during the day, how I can change that, my lifestyle. But now, so let me, again, so we can get back to the point. So give us some examples of what you told us, the chemical stresses. So what are the physical stresses? Some examples.
Okay, so the most common physical stress that we're all under every day is gravity. Gravity is relentless. And what we know is that front to back, our spine should be straight. But from the side, we don't want straight. We want curves. And the curves in our neck, that's the most important one that we work with. It's called the arc of life. Dr. Alfred Bragg, he's a world-renowned neurosurgeon. He did research and found that when you lose the curve in your neck, it stretches the spinal cord to put you in a state of pathological disease. It actually puts you in the stress response that we just explained. Another thing that can happen is that the joints in our spine can get stuck and locked up. We call that a subluxation. And what happens is stress signals, nociceptive, negative stress signals are sent to the brain up through the spinal thalamic tract. It causes a release in stress hormones, and it puts us into the stress response that I just explained. So we want to be aware of whatever causes stress in our life, because now we're not running from tigers. Now, the most common stressor is gravity pushing down against us, but the first stress, the first physical stress that we all encounter is the birth process. The birth process is the most aggressive stress that we're under. And I'm going to be honest with you, Doc, I'll share something personal really quick. We just had our second baby 6 weeks ago. I literally delivered him at home. I caught him at home with the midwife. I caught him. So I was there during that situation. And the birth process is traumatic. And according to Dr. Taubin, he's a Harvard-trained medical doctor. He did research and found that 93% of the time when they're pulling the baby out, C-section or natural, 93% of the time, it shifts the first bone right there, called the atlas in the neck, out of alignment, and it puts pressure on the brainstem. And that's the first physical stress that we're under. And when that happens, the first physical stress, that birth process, right? Birth trauma, that sticks baby in fight or flight. That sticks newborn in fight or flight. How does that show up for baby? They're colicky. They're constipated. They're fussy. They have reflux. They're not resting. They're not digesting. From there, because they're stuck in fight or flight, a lot of times they'll tell you, don't worry, they grow out of it. They don't grow out of it. They grow into it neurologically. And what can happen from there is a lot of inflammation and a lot of congestion. It can lead to sinus and allergies. It can lead to ear infections, which is a drainage issue. From there, it goes down and it can cause bronchitis and problems with the lungs, and they get sick a lot. From there, it goes down. It can create problems deeper in the lungs like asthma. And from there, it goes down into the gut. So from there, usually toddler into school years, that kid who's stuck in fight or flight, they didn't grow out of it. They grew into it neurologically. And usually that leads to that child developing feelings of anxiousness, even in school. It can lead to tics. I specialize in pediatrics and pregnancy, so we have a lot of kids coming in with verbal and facial tics. They're anxious. They have social anxiety. They don't want to stay in school. That leads into the teenage years. Mental health issues have skyrocketed into people in their teenage years and into their 20s. Mental health and back pain are the two top leading causes of disability worldwide. the top two right there. So what I like to do with our patients is I like to do exactly what I'm explaining to you. I like to bring them back to say, hey, what are the most common types of stress and how can we counterbalance it? And then, of course, you throw in, car accidents and playing sports and sitting and texting and tech neck like this. I mean, it's a nightmare. So physical stressors, at least when I grew up, we were running around a lot. Now these kids are sitting and texting a lot. So I think it's affecting kids really early on. So, yeah, those are really, really common types of physical stress.
Very interesting. Now, I want to ask you something about the birth, because not every baby experiences that colic and whatever you say. So what you're saying is if they go through a traumatic birth, is that what you're saying? Or because the mother is stressed and so then the birth is traumatic because of the stress beforehand? Explain a little bit more of that, because I think it's a very important topic you just hit on there.
Yeah, so if moms let's say that, and this happens over 50% of the time, let's say it's high-risk pregnancy or there was an issue getting pregnant because there's a decrease in sex hormone binding globulins, maybe there's toxicity affecting the liver, sperm count is low, people having babies at an older age, it's a little tougher to get pregnant. Let's just say there's that situation, or let's say it's not that situation. Mom got pregnant, no problem. During pregnancy, if mom's under stress hormones are released, and it can lead to a condition known as uterine torsion, where the broad ligaments that suspend the uterus, they actually have muscular fibers in them. These are the only ligaments in the body with muscular fibers. A lot of times it can lead to uterine torsion. So baby's in a position where maybe they're not going head down.
I see.
And so a lot of times, if they're not going head down, that can lead to C-section. Or if baby does go head down and it's a natural birth, and there's quotes on this, even during optimal birthing conditions during labor and delivery, it's still very traumatic to baby. 93% of the time, the first bone, the atlas, is shifted out of alignment, and the kid might not show signs of colic or issues right away. You're right, they might not have any symptoms right away. But we always tell people, listen, symptoms are the effect. It's the last thing that happens. So we actually check a lot of babies after the birth process.
That's exactly, I'm sorry to interrupt you, but I want to get to this point. So when the baby's born, what do you recommend should be done because of that atlas and the axis, what you're talking about? What should be done?
Okay, so my second son's name is Atlas. The first son has the same name as me. I'm the fourth, he's the fifth, so his name's Emil. So it's a generational name. So my first son was born, has the same name as me, and he was born on my birthday. The second son, my wife came up with the name for our second son, and his name is Atlas. And so Atlas is the firstborn in the neck. So when Atlas was born, which is a completely natural, healthy birth at home, my wife didn't even have an IV. There was no pulling, there was no twisting or anything like that. As soon as he was born, I laid him down and I gently checked his atlas, which was definitely stuck and locked up, and I gave him a gentle adjustment right away. Both my kids were gently adjusted at birth. It's super gentle. Like you could think of it like just light pressure. But that's what I do with my own kids. And I've adjusted over, many, many babies over the years, over 20 years of doing that since 2001, almost 23 years at this point. And I've checked and adjusted many, many newborns. So That's what I would recommend. But typically people don't know to have that check, so they don't come in right away. So they typically wait till symptoms. So, for example, if I could just tell you one thing, so maybe, baby doesn't have an issue right away or something that mom or dad, they're not really picking up on. But maybe like an example of a patient we just had come in recently, came in for eczema, 4 years old. And they were referred by another family where the child has experienced like severe eczema. They've been to every specialist. And I explain exactly like I'm explaining to you. And we kind of dig into their history. What was the birth like? Were they formula fed? Did they latch? Because if they were given formula, which is cow's milk and corn syrup, that creates insulin resistance right away. That sticks you in the fight or flight stress response. So you're asking about chemicals. Well, and I'm not judging, because here's another thing. When I go over information, I got taken to the hospital. I got an injection. I've done things for my health that wasn't like necessarily the best thing over the years, for sure. So there's no judgment here. But what I'll do with parents is I'll say, look, if the tight junctions in the gut are broken open, it can lead to a condition called leaky gut, where food particles that we eat can actually go into the bloodstream. Your body thinks it's a foreign invader and it mounts an attack, and it can create an autoimmune situation, but it can create systemic inflammation. So I make families aware of the 5 things that can cause leaky gut, because they're going to affect the microbiome, which we know 80% of our immune system's in our gut. So we want to have a healthy gut. So one of the first things is C-section. The second thing is antibiotics. The third thing is prescription medication. The fourth thing is a poor diet. And the fifth thing is being stuck in fight or flight stress response. So when a kid is stuck in fight or flight, or when an adult is stuck in fight or flight, that can cause leaky gut. So we make people aware of this. Yeah, it sets up a cascade.
You know what, Dr. Tocci? It's been a fantastic half hour with you. And unfortunately, we run out of time. But, I got to tell you, you've given us a wealth of information. And I am really, I know the viewers are going to probably say this, they're going to kill me if I don't, is that I want to have you back. So can you come back again?
Oh, absolutely. I'm so sorry I didn't get to answer the questions, all the questions that you were asking. I apologize. I would love to come back.
You know what? That's why we're going to have you back. And this topic is extremely important, and quality is much more important than anything else. I think we've had a tremendous interview. So one of the things I wanted to ask you is, if someone wants to get a hold of you, what is your email?
Oh, sure. So you can email my office. It's my last name. It's Tocci family, CHIRO. So Tocci Family Chiro at gmail.com. Tocci family, CHIRO at gmail.com. Tocci Family Chiro at gmail.com. We do have a website they can go to also. Should I give the website?
Sure, absolutely.
Sure.
Go ahead.
Yeah, it's my last name. It's Tocci familychiro.com. So the email is toccifamilychiro at gmail.com, and the website's toccifamilychiro.com.
Well, fantastic show. I know all of you probably feel like I do. A lot more understanding, a lot more awareness, and we've got something we can do now. So, Dr. Tocci, thank you so much. And for all of you watching, have a great day, and we'll see you on the next episode of A Time for Truth show. Have a very good night.
Take care. Thanks so much.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet